How does insulin resistance contribute to mental health issues? My name is Dr. Ruth Otten. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap of mental health and metabolic health. And most people think of insulin resistance as that thing that you get diagnosed with when your blood sugar is slightly elevated, so pre-diabetes. However, by the time your blood sugar is showing some elevations, it means that you've had developing insulin resistance for years. And so a few more sensitive screening measures to test for insulin resistance would be looking at your waist to height ratio, looking at your triglyceride to HDL ratio, and if you can get your provider to order it, looking at a fasting insulin. If you're able to catch this insulin resistance before any glucose changes are noted, then it's a lot easier to reverse with dietary and other lifestyle changes. So what happens when there's insulin resistance? Why does this affect the brain's functioning? So essentially what happens is when there's insulin resistance, your brain cells or neurons are essentially not able to take up the glucose in the surrounding fluid to utilize it for energy because the insulin essentially isn't as effective. So even though the neurons may be swimming in a sea of glucose, they're not able to use that glucose for fuel. And so they're essentially starving. And of course, that's going to cause dysfunction in the cellular metabolism because if it doesn't have the energy it needs, how is it going to perform all of the functions that it needs to perform? So this can lead to symptoms like brain fog, depression, anxiety, and much more. If, however, you're able to address that insulin resistance and make sure that your neurons are adequately fueled, then you should notice improvement in those mental health symptoms. What are things that affect glucose levels and insulin resistance? Well, of course, your diet is going to be huge. So consuming things like refined sugars and carbohydrates, eating all day long, and eating just too many carbohydrates. And then non-dietary factors are going to be things like stress management and making sure you're getting adequate sleep and making sure you're getting regular exercise. Exercise is going to activate your cells to be able to take up that glucose in your blood. And muscles are essentially glucose sponges. And so they soak up all of that glucose from your bloodstream. And if you're sleep deprived and chronically stressed, then your cortisol levels or your stress hormone is going to be through the roof. And this contributes to high blood sugar levels and growing insulin resistance. There's so much more to this, but this is just a brief introduction. If you have any further questions about what I've talked about in this video, please share in the comments below. I'm happy to answer them. Wishing you all good mental health today, and I'll see you in the next one.